AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
And talk from you. Hi, welcome to You and Your Doctors. You can find us here every Tuesday from 6 to 7, and we're presented by AMP2 TV, and All County Healthcare is our sponsor. Thank you so much, All County Healthcare. We love it. The other thing that you can do is that you not only can hear us on 1470 AM, but we also stream live on amp2.tv. That's AMP2.tv. And also All County Healthcare. You can watch us there, allcountyhealthcare.com. All County Healthcare, where patients are the heart of their business, ends up bringing some of the most fascinating, most informative, and insightful doctors and centers into this show so that we may be informed with the latest up-to-date information, especially with Medicare and some of the changes that are going on right now. So if you have any questions whatsoever, I truly ask you, please call in 888-565-1470. Give us a call. We'd love to be able to help you make those informed choices and also help with the Medicaid and Medicare understanding where you need to go, how you need to do it, and that's one of the reasons why we bring on all these doctors. So welcome. It's great to have you. Well, I'd like to introduce our first guest tonight. It's very exciting. We have two guests this evening, one here at 6 o'clock and then another one at 6:30. And tonight we have Erica Jones. She's the Regional Director of Administrations for Southern Healthcare Management. So welcome, Erica. It is wonderful to have you here.
Thank you.
Tell us a little bit about who you are, how long you've been in the business.
Sure.
Share with us.
I am a regional director of admissions for Southern Healthcare Management. It's been about 2.5 years now. I have been in this business for about 15 years.
Wow.
I've worked in various capacities from the geriatric care management role, keeping patients out of nursing homes through the nursing home diversion program.
Wow.
I've worked in senior living, retirement communities, as well as the skilled nursing and rehab facilities. So a lot of my career has been focused on seniors and helping seniors to be
wonderful.
Their best.
Yeah, that is wonderful. And from your background, it sounds like you've hit every single piece of their life and how they manage the life.
Yep.
Well, very exciting. Very exciting. Well, it's great to have you here.
Thank you.
Tell us a little bit more about what you do, the admissions.
Sure.
You had mentioned that it's skilled nursing and rehab. Give us some insight there.
So Southern Healthcare Management is the parent company. We own and operate skilled nursing and rehab facilities. And so one of the biggest questions that I always get from different people is, well, what is that? Rehab, we think of drug rehab these days. What the rehab center is designed for is for after a patient has been through the hospital and is well enough now, they're not well enough to go home, but they're no longer acute. Whatever brought them to the hospital is now stable and they're ready to move to the next location. And so that's what we provide. That skilled nursing and rehab service is the therapy services, physical therapy, strengthening, reconditioning, the occupational therapy, being able to do things again, button your button, open a jar, balance a plate now with a walker in your hand.
Wow.
And then speech therapy, swallowing function, vocalization, memory recall. So we do the therapy as well as any wound care services that a patient might need, IV medications, different treatments for COPD, CHF, congestive heart failure, different things like that. So we have a variety of programs that we work with our patients to get them well enough to move on to the next step.
Yeah. Or to be able to go back home as well.
Yep.
So how many facilities do you have currently?
For Southern Healthcare Management, we have 28 in the state of Florida, and we have 3 in Georgia and 10 up in North Carolina.
Wow.
So my territory is from the Volusia County area south here to Palm Beach County. And so in Palm Beach County, we have 3 facilities. It's Boynton Beach Rehab, which is located on Lawrence Road, Boulevard Rehab, which is right next to Bethesda Hospital East, and Medicana Nursing and Rehab, which is up off of Lake Worth Road.
Okay, great. Excellent. So if they need to get a hold of you, how do they manage to do that? How can they get a hold of you?
Well, they can certainly reach out to the facilities directly. If anybody has questions and wants to reach me, they can call me. My number is 954-559-3394.
Okay, excellent, excellent. And when it comes to the therapies and everything, I'd like to go back into that therapy and identify what kind of therapies, who qualifies for that, other than possibly, is it just for the seniors or is it for?
Traditionally,
okay.
Our facilities are Medicare based, so Medicare pays for the services that the patients patient's receiving based on their hospital stay. We also accept Humana in a couple of our facilities, so Medicana and Boulevard do take Humana. So most of the patients, though, are going to be, I think our younger patient might be 55, but the majority of our patients are, 70 to 80 to 105 years old or higher. There is no age limit. I think our eldest patient right now is 107.
Oh, my goodness,
So,
107.
And, that's one of our patients up in the Palm City area.
We are living longer and longer, aren't we?
Yes, we are. And that's why healthcare is so important.
Yeah, absolutely.
So the therapies that the patients could receive vary from, anything from anodyne therapy to, electrical stimulation to kind of bring some blood flow back to the muscles, reduce pain.
Anodyne, can you explain that a little bit, please?
Anodyne therapy, I'm not a therapist and I'm not a nurse, so I don't know the ins and outs of it.
Okay.
But I know it has to do a lot with pain management and helping the lymphatic system.
Gotcha.
So, the therapy really is focused on, if you can imagine, a patient who is living at home by themselves and they've been completely independent. They've made their own meals. Maybe they're, driving to their doctor's appointments and everything. That patient now has a fall and has an injury. Now they have to use a walker. Well, if you can imagine, on average, it takes 12 minutes for someone to make a sandwich. Well, now imagine that you have a senior in their kitchen and they have a walker with them, and now they've got to figure out how to maneuver with the walker, open the fridge, reach down in the drawer, get out the lettuce, get the bread out of the cabinet, get a dish from here, load the dishwasher, all of these different things, while now having this assistive device. So we practice those things. So in some of our facilities, like our Boynton Beach Rehab facility, we have a kitchen area, we have a laundry area, so patients can practice all of those different things.
Isn't that great?
To get them to be back to their independent level and their lifestyle.
Wow. I mean, it really sounds as if you've really dissected, every aspect in the lifestyle and then be able to have them practice and become strong enough so that they can maneuver on their own.
Right.
Wow.
And one of the really cool things, one of our favorite pieces of equipment is at the Boynton Beach Rehab facility, we have a piece of equipment called the Alter G. It is an anti-gravity treadmill. And so for patients who have had a stroke and maybe one side of their body is very weak and they have the potential that they could kind of give out or their knee could buckle, or patients who experience pain, patients who have had a surgery and they're not able to bear weight on that lower extremity just yet, like a knee replacement, a hip replacement, those patients come into this treadmill, it zippers around them and it fills with air. And we can off-weight the patient by up to 20% of their body weight. So it's like walking on the moon.
That is.
So a patient who can't walk normally on ground because there's pain or there's just no connective tissue, whatever the situation is, now they're able to experience that walking pattern, see it on a TV screen while they're doing it. So if they're dragging their foot, they can self-correct. It's a really cool piece of
That
equipment.
sounds amazing. I want to come try that out.
You'll have to come. Make sure you wear pants.
Okay,
And no heels.
Okay, no heels.
No
No, I know
heels.
better. Excellent.
Yeah.
So, give me some other insight. I mean, what's a typical day for a patient there?
Well, typically when a patient arrives to our facility, they're going to be screened by our nursing team to see what their clinical needs are. We communicate with the doctor, make sure the medications are all accurate and correct, and then we start their therapy. So the physical therapist will come in and do an evaluation. We kind of talk about what their prior level of function was, what were they able to do before they wound up in the hospital. What their goals are. We work with the families to kind of find out. Sometimes the patient's goal might not be in alignment with what the family's goal is. So we try to, work as a team and get that patient to start their therapy and start working on some of the things that are going to need to be done to get them to where they need to go. And, I don't like to exercise, and I can't imagine being 95 and being told that I now have to do all of these different exercises. But it's so important to the wellness and recovery of that patient.
Absolutely.
And the outcome that we see really is a lot of times driven by how motivated that patient is. If you have a patient who is really excited and wants to get through their therapy and wants to get back home, they do so much better because of that energy and that enthusiasm
Yes.
than the patient that kind of, the therapist goes in and they say, okay, it's time for your treatment today. And they're like, why don't you come back in an hour? I'm not really up to that. Or, and rightfully so. Some of our patients are experiencing pain. They're tired.
Oh, yeah,
It's
that's
hard.
true.
It's
Yeah,
hard.
it is.
So, we try to do different things to get the patient to do their therapy without them
Motivated,
realizing
huh?
that
And
they're
you-
exercising.
Yeah.
A lot of times for a patient who needs to work on their balance issues, we have what's called a standing table. And so really they're literally standing. There's a little harness around them just to keep them from collapsing or falling. And we'll put something in front of them like a puzzle or, a game or something. And it distracts them from realizing how long they're standing. And if we're trying to increase their standing tolerance from, 5 minutes to 10 minutes, and they're standing there and they're having fun doing something, they're not thinking about how much pain they're in, or they're not thinking
Yes.
about their knee is wobbling. So it's a
oh
good
my God, that's
distraction
fabulous.
method.
Yeah, that is great.
Yeah.
That is great because I've got to tell you, many times when when you're in pain, it completely takes over.
Yeah, it's all you can think about.
And that's all you can think about. Absolutely. So if you can distract them, and get them out of their head,
Right.
and have them, placing that attention
Right.
someplace else.
Right, refocus them.
Absolutely. And then all of a sudden they're not feeling that pain anymore.
Right.
Very interesting.
Right.
Oh, I like that.
Yeah.
That is really good. So what other kind of treatments are provided by your facility?
Well, we do have wound care. So sometimes patients come to us. We've had anything from, a patient who was bit by a spider and has now a, wound area from that bite, all the way to patients who don't have a lot of mobility. And so they've developed sores, in certain areas. Those need to be tended to. We have patients who have an amputation. We have a lot of patients who are diabetic, and so the neuropathy kicks in, they lose circulation, and they wind up having amputees, unfortunately. And so, we work with that surgical incision. Any patients who have had some sort of surgery, cardiac surgery, of course, you're cutting open your entire chest cavity. If you're having a hip replacement or a knee replacement, usually there's a incision that goes along with that. So we do have a
Right.
dedicated wound team that rounds at the building and helps to support the healing of that wound tissue and making sure it stays clean and clear of infection.
Wow.
And then IV administration, with patients who have had a virus or a infection, we can administer the IV medications. And then some patients come to us, they're on a feeding tube because either they've had a swallowing issue, they've had a stroke, they're not safe to swallow regular foods, solids, liquids. And so we put them through the speech therapy program. and the speech therapist works with them. I know it's a misnomer because when we think of speech, we think of being able to vocalize, but speech therapy also works on that swallowing function. There's a treatment called VitaStim. So it's electrical stimulation for your swallowing muscles. So you're swallowing, all of that is a muscle just like everything else.
Right.
So if you can revitalize those muscles and retrain those muscles on how to swallow, a lot of times we have great success with getting patients off of a feeding tube and back to being able to eat normal foods again.
Wonderful. That is wonderful.
Yeah.
I'd just like to say thank you so much for All County Healthcare for sponsoring this show. We have got some of the most informed individuals here with the up-to-date technology. And also today you're learning about how this rehab center, what they're doing to be able to bring the patient back to their normal level of living and be able to go back home again where they feel safe and comfortable and happy again. You know, they're in familiar surroundings.
Yep.
So I'd just like to say thank you again to All County Healthcare for bringing this together.
Yes, thank you.
Absolutely. So who has the choice then in being able to come to your facility? Who makes that choice? Does the hospital or does the patient?
I mean, ultimately, it's the patient's choice.
Okay.
You know, with the guidance of the family, a lot of times patients don't pre-plan a hospitalization.
Right.
So, you know, we kind of work with the family to give them a tour, let them see what the facility looks like, kind of get a feel for the programs and who the doctors are and, you know, what the nursing team looks like, to really get a clear picture of what that next setting and see what that's going to be. And so the patient usually is given a list in the hospital. The case manager comes in and says, okay, your doctor's saying you need to go to rehab. Here's a list of 15 in the area. Where do you want to go? And, you know, you're talking to a patient who's probably never been to one,
Exactly.
let alone heard of them.
Yes.
So, you know, a lot of times the families are out of the area. So what my team does, my admissions directors will go over to the hospital, meet with the patient at the bedside. We have kind of a device like what you have there, where
it's an iPad, so you know.
Yeah, we have a different version. But
Okay.
the patient's able to see on the screen, you know, pictures of the facility, our star ratings, and, you know, really talk about what the patient's going to experience when they get to the facility. And we try to educate them at the bedside as best as we can, since they're not able to come over, obviously, and take a tour themselves.
Right. Oh, that sounds wonderful.
You
know something. One of the things that I also am picking up is that there's such a wonderful bedside manner. I mean, like you're really in tune with the emotional needs of the patients, not only the mental, the physical, but also the emotional, because that happens to be one of the areas that can really have them be in fear, scared. You know, what are they going to do now? And that can lead right into depression as well.
Yep. And you're right. I mean, you know, the patient is in completely unfamiliar surroundings.
Right.
So, you know, they're admitted to a rehab facility. There's other patients there that are sick and have other medical issues going on. You know, you've got new nurses that are taking care of you, different from who helped you in the hospital. You know, it's new.
Even the hospital experience can be unnerving.
It's usually related to a traumatic experience.
Right.
So yeah, we do work with patients. To your point, you know, trying to keep their spirits up. We have a dedicated activities team. We have things that go on all throughout the day, from the spiritual aspect to the fun aspect. We have movies, we have games. You know, with the generation of seniors really adapting to the Wi-Fi now.
We have the social media. Huh?
Yeah, we have a complimentary Wi-Fi in our building, so we do have a lot of seniors who bring their laptops and iPads with them, and they Skype with their grandchildren.
Aww.
So, you know, it's fun, and we try to make it as pleasant of an experience as it possibly can be. And, you know, when you walk into the therapy gym and you see the smiles on the patients' faces because they're just so engaged with their therapist, or when you see the nurse with a patient in the hallway, you know, there's just that level of engagement and care that's affiliated. You know, I don't think any of us go into the healthcare field for the money. We are there because of the compassion.
I think you're right.
Absolutely. And the love that we have for other human beings and wanting to take care of them as best as we can.
Yes. That's wonderful. So how does the transition then work from the hospital then to your rehab center? How does that work?
So typically, we get the referral from the hospital staff letting us know that the patient needs the services. We go, my director of admissions will go to the hospital, visit the patient at the bedside. We have access to their medical record at that point to kind of see what the patient's needs are going to be. That information is communicated back to the facility, the nursing team, so that we can prepare for the arrival of that patient. So any equipment that the patient might need, if they have oxygen needs, we're going to have the oxygen concentrator in the room and waiting for them upon arrival.
Excellent.
If we know that they're going to be on IVs, we'll have the IV pole ready. So whatever the patient's needs are, we try to anticipate that. We have everything in place so that it is a smooth transition, and we get the medications ordered so that they come relatively quickly after the patient admits. We don't have an on-site pharmacy, which is a challenge. They always want to have their pills as soon as they roll through the door, but we've got to wait for the delivery. So and that's skilled nursing across the board.
Yeah. Wow, it's so reassuring. And that's what I want to say. Please, Southern Healthcare Management Company, they've got 3 different facilities. If you have any questions for Erica, please give us a call, 888-565-1470. Again, that's 888-565-1470. And if you don't quite call in at the moment, but you do have some questions, just give us a call there at the 888 toll-free number, and we'll make sure that we get any of your questions to the proper person. So that is absolutely wonderful. So tell us a little bit more about what happens if the patient can't go home?
Well, so part of what we do is the traditional nursing home care. And so, a lot of times people think of facilities as nursing homes. There is a component of our facility that is dedicated to the recovery efforts and wellness of the patient. And then there is a portion of our facility that is dedicated towards the care of someone who isn't able to return back home. So for those patients that really don't make their progress the way that they want to and that they need to be able to return home, we do offer long-term care services. So on an ongoing basis, some patients might require that 24-hour RN coverage and nurse availability, assistance with taking a shower, getting a bath, their medications being managed, help with meals, help with being fed if they need to, incontinence type situations. So we're able to manage that really all throughout the entire continuum until the patient, is no longer with us. And we do offer hospice services in our buildings as well.
Okay, great.
So we become the home at that point for patients who can no longer manage at home.
Excellent. And give us the facilities, where they're located again, the names of them, and their addresses.
Oh boy, you're going to test me now. So I'll start with the one I know off the top of my head.
Okay.
So Boynton Beach Rehab.
Okay.
That is our 168 bed. That's probably one of our largest facilities.
Okay.
They're located on Lawrence Road. That's the one that's got the anti-gravity treadmill.
Okay. I'll have to come and visit that.
Yeah. They're located at 9600 Lawrence Road in Boynton Beach.
Okay, excellent.
The next one is located right next to Bethesda Hospital Boulevard Rehab.
Okay.
They are the ones that take Medicare and Humana.
Okay.
And they're located at 2839 South Seacrest Boulevard in Boynton.
Okay.
And then our third location is up in Lake Worth, and that's Medicana Nursing and Rehab. That's one of my smaller facilities. There are 103 beds, fantastic staff. We're actually 5-star rated with ACA.
Wow.
Excellent care. The team there has been there for 20 years. We have some nurses who've been there probably since the building opened.
Oh, my goodness.
Maybe. But, they're just a great team. They're located at 1710 Lake Worth Road, and that's in Lake Worth, Florida.
I think you did fabulous.
I remembered them all.
Yes, you did. You did.
I surprise myself sometimes.
And if they need to get a hold of you, where do they call?
They can call me at 954-559-3394.
Excellent. So, I'm going to take you in a little bit of a different place. because this all sounds really expensive. Who ends up paying? How does that happen? How does that work?
Well, when a patient comes from the hospital setting, if they've had a 3-night stay in the hospital, their Medicare benefit will cover them for 20 days at 100%. So for 20 days, they can be in our setting with no out-of-pocket cost. After that 21st day, there is a copay, and a lot of seniors have a coinsurance like a Blue Cross or an Aetna supplemental insurance that will cover that copay. If they have Humana, that is their primary insurance, they don't need to have the 3-night stay in the hospital. They can come to us under their Humana benefit, and that would be the Medicana and Boulevard facilities that take Humana. And so they would be able to utilize their Humana benefit, and depending on the plan, depends on the copay. So some of the copays start in day 5, some start in day 11, and the copays vary from $5 a day up to $150 a day, depending on which Humana plan they've signed up for.
I gotcha.
Now, if a patient is going to stay with us long term, or maybe they're not in an acute situation, they've not been in a hospital, and they really just need to come to us for the long-term care services, they have 2 options. They can either pay privately if they have the funds and the resources, or they can apply for Medicaid benefits.
Okay.
And so through the facilities admissions office and business office, we're able to guide patients on how to best pay for that service.
That's wonderful. Well, that's wonderful information. Thank you so very much.
You're welcome.
And if you have any questions for her, she did give out your telephone number one more time.
Sure. 954-559-3394.
Yes. So if you have any questions, please just give her a call directly, especially also if you know that you are going to have a hospital stay, some
Planned
sort of surgery, yes, planned surgery coming up in the future. Please give them the call and let them know so that they can prepare for you to visit the facility and be able to make that transition very easy. They'll be prepared for you. So I'd like to thank Erica Jones again for being with us.
Thank you.
And we're going to break for a commercial. Please stay tuned. We have Dr. Bronson coming on next, and he's going to discuss with us the difference between orthopedic foot and ankle surgery and what a podiatrist is. So please stay tuned.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. This is You and Your Doctors, sponsored by All County Healthcare and also presented by AMP2 TV. Just so you know, we are filming live. So if you want to watch us on internet, please go to amp2.tv. That's AMP, the number 2.tv. Or you can go to allcountyhealthcare.com and you can watch us live. And also, if you have any questions for any of our guests, please give us a call at 888-565-1470. We're thrilled to hear from you. Please give us a call. So I'd like to welcome our next guest tonight, Dr. Bronson.
Yes.
And he's going to talk to us about orthopedic foot and ankle surgeries and the difference between podiatry and what he does, and the importance of understanding the differences. And very informed and educate us, help us, let us know.
Well, I'm an orthopedic foot and ankle surgeon, and there is a difference. I went and got to medical school and got an MD, and then we do a 5 or 6 year orthopedic residency. So I am also a general orthopedist, which means I can do all parts of the musculoskeletal system. I did do a fellowship in foot and ankle, so that's my subspecialty.
Gotcha.
The difference is podiatrists will go to a podiatry college and will just do foot and ankle, though in this state they can actually go up to the knee. So there's a lot of overlap in terms of what's done. Mm-hmm. But, with the orthopedic part, you can do more than just the foot and ankle.
I see. Well, that's very interesting. So it sounds like you're highly educated.
You could say so, yes.
Absolutely. So give us a little bit more, what's the importance of proper footwear?
Well, you're on your feet a lot, and there are obviously a lot of different shoes and things out there. And when you're doing a lot of walking, if your shoes aren't comfortable and they don't provide the necessary support, over time, you can get into a lot of problems. So we always get into the conflict between being fashionable and being comfortable.
Yeah, I understand that. Yes, absolutely.
So, a lot of people know it for sports, and they'll choose sport-specific shoes. But when they're walking, a lot of people will choose something that looks good. And that's okay if you're going to be on your feet for short periods of time. But if you're on your feet all day long, it can get painful. And over time, you can actually get problems from that. A lot of bunions and hammer toes are directly traceable in most cases to the use of improper shoes.
I see. Well, being a woman who has big feet, I love to wear heels because it disguises the length of the foot, right? So I understand, that over time you continue to wear those high heels, they're going to create some level of problems in the future for you.
Well, the heels look great, and they accentuate the shape of the leg. But the problem is that a couple of things. Usually the front of the shoe is narrow, so it forces the toes over. And over time, the big toe starts going over and the toes start to hammer. The other thing that it does, if you're walking in them a lot, it eliminates some of the motion in the foot, so it gets rid of some of the shock absorption. So over time, it transmits that up to the knee and the hip, and you can have an increased risk of arthritis.
Oh, wow. Very interesting. Yeah. And the other thing, too, here in South Florida, there's a lot of people that end up wearing flip-flops all the time. That's their go-to. They throw them on, they, go drive a car or go walking or whatever. So...
Well, people have talked about going barefoot, and there's some advantages doing that. But obviously, with footwear, you want to protect your feet. And for most people, especially if you're going to be walking on hard surfaces, even if you're going to wear a sandal, you want one that's a little bit more substantial than just a thin flip-flop. You want something that's going to provide some cushioning and support if you're going to be on your feet for a long time.
Mm-hmm. And some arch support, too, I would figure in that.
Yeah, there are a lot of, I'm not going to, specify a specific brand, but there are a lot of comfortable sandals and shoes out there, and they're sold all over. And that's the thing. We live in South Florida. We can wear them.
Yes, we can. That's what I'm loving about it too. Because I grew up in Chicago, so I would be talking to one of my girlfriends down here in November, December, and she's yelling at the kids, "Put on your flip-flops, we're going to school." And I'm like, flip-flops in December. Oh my God, I am so jealous. And now I have the opportunity, although I usually don't wear the flip-flops constantly, but I do appreciate the ability of just wearing sandals in November, December, January.
No, it can be good. I mean, they're open. The toes are open, so they have room to breathe and expand. They're not being crammed into a tight shoe.
Yes, exactly. And when you're up in the northern, regions, you need to protect them against the cold. So a lot of times, a lot of those boots and everything, you're right. They force your toes right up into the nose of the shoe.
No, and they can be uncomfortable. And as I said, over time, you can really get into some problems from that.
Excellent. So what are some of the other problems that you end up seeing?
Well, we see the whole gamut of injuries. I mean, a lot of sprains. I mean, ankle sprains are extremely common. And, people always ask, if I twist my ankle, when should I come in and see a doctor? And, it's hard to give a general rule. I mean, if you can still walk on it and it's not too badly swollen, gets better in a couple of days, you're probably okay just watching it. But occasionally people think they've sprained their ankle when they've actually fractured it. And common to what people think, you can actually walk on some broken ankles. I mean, there are some clearly you can't, but there's some ones that are stable. So it really depends on the severity. And if there's any question, you're better off seeing somebody.
So tell the audience, our listeners, how to get a hold of you and where you're located.
Our office is on Glades Road. We're right across the street from the hospital at 660 Glades. Our phone number is 561-391-5515.
Okay, give us that one more time and just a little slower so our audience can write that down.
The phone number is 561-391-5515.
Okay, great.
And then they can also find us online.
And what's the name of your facility?
It's the group is the Boca Raton Orthopedic Group.
Okay.
But we're located in the Hospital of Sandler Pavilion.
Okay, great. So in case you have any questions or concerns, or if put down the number just in case anything ever happens. Correct?
Yes.
Yes. And keep that near you, in case of emergency. Because I also know, as we age, our bones become more fragile. So, our chances of tripping and falling increase. What is the population that you see in that?
Well, at least in the office, we see all ages. I mean, from kids on up. I mean, to people who are fairly old. And obviously down in South Florida, we have an elder population. As you get older, your bones do lose calcium and minerals, so you can develop, technical term is osteopenia or osteoporosis. And it's not so much that makes you more susceptible to falling, but when you fall, you're at a higher risk for fracture.
Right.
But as you get older, obviously, your balance can go as well. So.
Exactly. And especially if you're not exercising.
Yeah, you want to try to stay in shape and be active. The more sedentary you are over time, it makes you're more susceptible to getting into problems. Your bones weaken, your balance decreases, your muscles decrease.
Yeah, they atrophy. Yes.
It's not healthy.
No, it's not healthy. So here's a really good idea and suggestion. Begin some level of exercise to be able to strengthen those muscles again, and also to build up on the balance, your ability of balancing, because that's critical.
No, it's definitely important to stay active and to do regular exercise, to eat right, keep your weight at the appropriate level, which is not easy.
No. And you're absolutely right. Watch the junk food and alcohol too, because that can be a problem.
It's okay in moderation.
Yes, exactly. So what are some of the areas, some of the changes that you see in your field?
The field keeps evolving, and there are certain problems that will fluctuate in terms of how they're treated. Achilles tendon ruptures, which are very common, especially in middle-aged athletes. People are staying active. A few years ago, the pendulum was more in operating on most of these inactive patients. I mean, you had the choice of treating them non-operatively or operatively. It's swung again. There's some papers out there that have suggested and actually shown that non-operative treatment can be effective. So my practice has actually shifted where the bulk of the ruptures that I would see a few years ago and would operate on, I'm now treating. We usually put them in a splint or a cast, then into a boot and start them on early rehabilitation. And studies show that they do pretty much the same as whether you do when you do surgery, but with a lower risk of complications.
Wow, that's very interesting because I just had one of my dear friends, Dr. Lisa Learn. She was in a ninja type of gym, and she decided that she was going to do the warped wall. Well, and she's, very healthy, good muscle mass, she works out, and she goes up on that warp wall, and she ends up popping that Achilles tendon and ended up having to go in for surgery and rehab and et cetera, right? So is it just a tear on the Achilles tendon, or if it totally tears apart, then you have to do surgery? Or
No,
how?
you don't anymore. Even if the rupture is complete tear, and the study looked at those a few years ago, and the key was in the old days we would immobilize them for a much longer period of time. Now we're putting people in splints or casts for 2 to 3 weeks, then getting them into a boot, starting to move it early, and we know that early motion helps tendons heal, and then we follow it with physical therapy. And when they've looked at the controlled studies, the results are comparable with less of a risk, because the problem when you operate, you get problems, risk of infection, wound healing problems.
Right.
Most of the time it doesn't happen, fortunately, but you do increase your risk with surgery. So there's still some people who we would choose to operate on. It depends when they present and where the tendon's ruptured. Also, most people would choose professional athlete to do surgery, so you can be a little bit more sure about getting the ends together. But otherwise, the results look pretty equivalent, with just surgery versus non-operative treatment.
That's really interesting. That's very interesting. I had a friend quite some time ago, about 20 years ago, and he thought he was a great basketball player, right? Hadn't played basketball forever, hadn't exercised, and then he's out there playing basketball and ends up tearing his Achilles tendon.
Now, that's common. It's the weekend warrior.
Yeah, exactly.
And they go, and then they can do the other side as well. I think one of the importance is when people get back, everybody decides they want to exercise, and there are a lot of different types of exercise out there. Some of them are a little bit more intense, and part of it is just getting back gradually, because if you do things too quickly, you increase the risk of problems, not only tearing tendons, but getting sprains. You can get stress fractures if you do things too hard and too quickly.
I gotcha. So give us some more insight on some of the other treatments for the ankles, the feet that you end up having to do with your patients.
Well, a lot of the procedures we do, obviously the acute injuries, so you have fractures, somebody breaks a bone, and not all fractures require surgery. You have to evaluate each one, but obviously we do a fair amount of fracture surgery. People break ankles, and if they're displaced, then they need to be set and properly fixed. I also do a lot of reconstructive surgery, so we were talking about earlier bunions, hammer toes. We treat arthritis in the foot as well. There are varying treatments depending upon where it's located. But sometimes they're replacing a joint. Other times you're doing a fusion. So those are common procedures. People can get pinched nerves called neuromas, and those often need to be operated on as well. So there are a lot of different things that we do.
So talk to me a little bit about the orthotics. What is that?
Orthotic is a fancy term really for a shoe insert.
Okay.
And what it does is they can have different purposes, but it's either designed to support the arch or provide cushioning and relieve pressure. Most people don't need it. You get a good proper shoe and that's fine. But there are certain people who benefit from having that. If you have a very flat foot, for example, it's very flexible, you need more support. If you have areas of the foot that there's too much pressure, you want to relieve pressure. So we do prescribe a fair amount of orthotics. There's also braces that you can do as well to provide stability.
Oh, that's very important, especially, as we get older, as we were talking, that sometimes those muscles atrophy. So your balance can be off. So it's really, really important to be able to take good care of that footing, your foot, so that you have the ability of being able to be independent, continue to be independent, and maintain a level of lifestyle that you're used to.
A lot of people don't think about their feet until they start to hurt. And then all of a sudden it becomes a problem. But, there are things you can do to try to minimize that and prevent it. In our practice, we are fairly conservative. Most of the problems that we see, we try to treat non-operatively. I've always felt that most of my patients are happier without a scar than with a scar.
Absolutely.
And you have to be careful when you go to see someone you have a problem if they're quick to recommend surgery. There are certain problems that are clearly surgical, but there are other ones that can be treated conservatively. And if I have a choice, usually prefer to treat it non-operatively. If it doesn't work, you can always go ahead and do surgery. But once you do surgery, it's kind of hard to go back.
Yeah, exactly. Exactly. Now, do you find that if you do the surgery on the various parts of the foot, does it increase the chance of arthritis, or is that a misnomer?
It's a misnomer. I mean, I think it's an overgeneralization. I mean, there may be certain surgeries that might do that, but most of the surgeries that we're doing are designed to make the foot better, to make, decrease pain and improve function. So there are some procedures that you do, ironically, you may do for arthritis, or you may do a fusion. That actually takes care of arthritis. It may increase the risk of developing arthritis in other joints, but usually you weigh that versus the amount of pain that the person's in at the time. So, I would say that it is a misnomer that by doing the surgery, you're going to increase the risk of arthritis. Having said that, you want to be careful when you're doing surgery on the feet. There are some practitioners who specialize in cosmetic surgery. I'm not a big fan of cosmetic surgery in most cases
Cosmetics.
on the foot.
Well, describe that a little bit for us. I have not heard of cosmetic.
Well, let's say you have a bunion or a hammer toe that's not hurting, and you're able to do everything that you want. Some people don't like the way it looks, so you can straighten it out and make it look better. Most of the time, you're going to get away with it. And the patient's going to be happy. But if you have a problem and you've now taken a painless deformity and either corrected the deformity or left it there and now it's painful, you haven't done anyone a favor. And,
Gotcha.
Since you're on your feet a lot, it's hard. I mean, it's different in other parts of the body where, you're not necessarily walking around.
I see. Well, if you have any questions for us, please, by all means, give us a call, 888-565-1470. And if you have questions about your feet or what kind of footwear that you should be having, give us a call. Or if you've been dealing with aches and pains in your ankles or your feet and you're not quite sure whether or not it's just a sprain or if there's something really serious, please give us a call. We'll help you any way that we can, because we want you to be feeling good and happy and on your feet, because that's really, really important. It's you were talking about the cosmetic piece of this, and many years ago, I'm gonna give you a little bit of insight on my feet. I happen to be a size 11. So, yeah, I'm tall, I'm 5'8" and everything, but a size 11 was really big. And as I was growing up, it was the hardest thing to try to find shoes. I couldn't find any. And I used to be made fun of course, because I had these great big tugboats. And it was even thought at that time that, well, maybe we'll take out a joint out of, one of my toes so that it brings down the size of the foot, the shoe, and I really kind of considered that for a while, because it growing up with these tugboats, it just made life really kind of difficult at times. But I decided not to do it. What's your take on that? I mean, do you see any of that happening, or is it just me with my big feet?
No, there are some people, there are times if you have, let's say, your second toe is significantly long and it's causing problems, where you could consider doing an isolated shortening if it's really very difficult to get into shoes. But for the most part, it's just better to find a shoe that fits the foot rather than operating on the foot to fit the shoe.
I know, I thought it sounded a bit extreme, but, as a young kid and growing up and being made fun of.
No, it's hard when you're in that situation. But again, that's where the cosmetic part comes in, because as I said, let's say you went through it and you were fine, that's great. But let's say you developed a problem. So now you have a painful area where you had a perfectly normal joint before.
Yes.
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 I'm not sure that's worth the risk.
Yeah, I probably have to agree with you. And that's probably one of the reasons why I did not do it. So I just wear heels, and that kind of, disguises it a bit. So, yeah, that's it. I'd like to thank All County Healthcare for bringing this show to you so that we can help inform you. Part of their basis of being in business is to be able to help you take care of you. to help you maintain a level of quality in your life so that you can have quantity of your life as well. So please, if you have any questions, give us a call. But I'd like to continue talking about feet and foots. And it's really interesting because there was a time where I ended up tearing off the bone off the back of, I think, my little toe or whatever. And my tendons were so strong that it just took that bone and tore off the back end of it. And it wasn't until that point that I really did appreciate my feet, because all of a sudden, I had to have surgery. I had to have a pin in it. I have a cast. I have a walker. So you not only, feel impaired by one leg, but then you lose the ability of, both of your hands as well, because you're busy walking around with the walker.
It can be very inconvenient. I mean, the surgery, some of the surgery may be minor, but the recovery can be hard, especially if it's your right foot and it's your driving foot.
Exactly, it was.
And one of the things that, I'll often get people come for second opinions, and a lot of times, I'll tell them you don't need surgery. But even the times when they may need it, some are saying, well, the doctor told me that they're going to be recovering very quickly. And I would listen, I said, it's going to take a lot longer than you think, because you have to walk on the feet. They're going to stay swollen. They're going to be painful. I've had some people who've come in to see me who are worried because they had surgery a couple of months before and they're still having pain and swelling. I'll say it's fine. And then they'll say, well, I was told that I'd be fine in 2 or 3 weeks. I said, they were probably a little bit optimistic.
Yeah, exactly. And depending on age too, and how well you take care of yourself. That all plays into it.
It depends, but sometimes the older patients will do better than the younger ones, because it all depends on the patients and
well, yeah, whether or not they're going to allow it to heal.
Exactly.
I have a few friends like that too. As a matter of fact, doctors are the worst in allowing something to heal. They cannot wait to get back on their feet, get back to work. Do whatever they need to. Mm-hmm.
It's hard to be away from your practice.
Yes, it is. Absolutely. So talk to me about physical therapy then.
Therapy in orthopedics is one of the key things that we do, because, a lot of people come in and say, I'm in great shape. Well, they may be in good shape, but some of their muscles can be weak. A lot of times when we exercise or go to the gym or do a sport, we're going to overemphasize and overexercise certain muscles at the expense of others. And when you get out of balance in terms of the muscles, you can get into problems. Mm-hmm. So what therapy will do is work on a variety of things, but essentially they're going to try to improve the motion. Mm-hmm. So if you're stiff, they'll get the motion better. They're going to make sure that all the muscles are appropriately strong and also balanced. They'll work on what we call proprioception or balance exercises, because we don't, when you're walking or doing activities, you're not thinking where you're putting your feet. But if you get injured, or as you get older, sometimes that ability decreases a little bit. So they can really work on your balance. There are modalities you can do like ultrasound, electrical stim, but I always tell people when they come, they say they've gotten physical therapy, and I'll ask them, say, what did you get? And if you've just gotten modalities, that's not enough. You really need to have a good strengthening program, a good proprioception program to really work on all areas. But it's amazing how physical therapy can help a wide variety of problems.
Yes, absolutely. Now, do you have that within your facility as well, or do you source that out?
We have physical therapy as part of our practice,
okay.
And if it's on the plan and if it's convenient for the patient. Obviously, if it's somebody who's traveling distance, there are other therapy places, but we do have physical therapy on site. We have an MRI machine on site.
Oh, excellent.
We try to make it one-stop shopping if we can.
I like that. Well, and you almost have to, especially for, a lot of the seniors. It's not always easy to be able to go from this place to that place to this place, to try to get the proper care. So I like the fact that you've brought it all together for them so that they don't have to go all over the place.
We try to do it there. For some of the seniors who have problems and they can't leave the house, and that's, we'll use home care like all county. To go ahead so they can actually get physical therapy at home.
Oh, excellent. Give us some of the insight about some of the newer treatments as well.
Well, there are some newer treatments that have been out there. Obviously we talked about there's some change in treatment with the Achilles. There are ankle replacements out there. They've been around, but they become more popular. Mm-hmm. There are some, what I like to call more investigational or experimental treatments out there that people hear about or advertise. So you get the platelet rich plasma injection stem cells.
Okay.
And there's promise there, but they're not covered by insurance. And, and the reason is they're still waiting really on some of the studies.
Gotcha.
So there are certain problems where there may not be a good regular solution, and I will recommend and do some of the procedures. But generally, we try to practice what we call evidence-based medicine first, which is procedures that have been around, studies have shown that they work, and those are generally covered by the insurance companies.
Well, I can't thank you enough for being our guest today. Thank you for taking time out of your busy schedule, because I know how busy you are, to come and share with us your expertise and letting us know also exactly what you end up providing for us. So thank you very, very much. I appreciate your time.
Thank you for having me.
My pleasure. If you have any questions whatsoever, please give us a call, 888-565-1470. Also, you can find us here, you and your doctors, every Tuesday from 6 to 7. We will have the most qualified experts and professionals here to be able to answer any questions that you might have concerns about, because it's all about you. We want to bring you the information so that you can make the proper choices in your health care. So thank you for tonight. Thank you for joining us, and we look forward to seeing you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.